and welcome to today's lesson about ear, nose, throat diseases and how we examine the patients for any kind of fracture or disease in the mouth. So we can start with if we have trauma against the mouth where the teeth are engaged, we might have a fracture of the tooth, or a tooth have fallen from the mouth, and in this case we want to be able to select which tooth is the one that is that has been engaged in the trauma, and for this we can use this chart where you have the upper right part of the teeth, we call it 1, and then we have the upper left, which we call 2, and then down to the right we have down to the left we have 3, and then down to the right we have 4. And by this way we can say, for example, if we want to say that this tooth is the one that is engaged, then we say 2, 2. And if we want to say that this tooth is engaged, then we say 3, 2, and so on. So we start counting from the line in the middle. And now when I examine the patient for fractures in the face, we want to we start with palpating the face from outside, and then we look for any kind of irregularities that are abnormal when we palpate, and we even ask the patient if they feel when we touch the face, and what do they feel. If they don't feel anything, then that indicates a nerve has been, there is a trauma and the nerve has been cut or damaged. And yes, but before palpating, of course, we inspect the head, and we look for any kind of hematomes or any kind of open wound, or we look for any signs of trauma. And to go through the all kind of fractures, you can take Muscovin, and for example the orbita, it can be an orbital floor fracture like this, and where you have muscles of the eye being pinched here. So we have a muscle going down like this, and they become pinch into place by the two bone plates, and which can cause diplopia, and where the patient sees double image in certain directions when we examined eye movement, and they can even feel pain, and we might see enophthalmos, and that is the eye going inside. And this requires surgery, and it's even more urgent to find this and deal with it in children, because they have more like a green stick fracture, where there is a higher risk for necrosis in the muscle that might spread. And then we might even have fractures in the mandible, and the fractures can go here or over there, and cause problems with will patient eat or talk. So it requires surgery if it's dislocated, and there are indications for surgery. And then we can have fracture in the maxilla, we can have fractures in the zygomatic bone, we can have fracture in the nasal bone, and in the frontal bone, and there is even a classification that is called Lafort classification, where you have Lafort 1, where it's only the maxilla that is involved, Lafort 1, and then we can have Lafort 2 fracture, where even the nasal bone is involved too, and then we can have Lafort 3, where even the zygomatic bone is involved. And in, for example, Lafort 1, we can, when we examine the maxilla and if its movement, we can see that it's dislocated, and it's moving from its place when we apply some pressure to it. So that was like some overview of the fracture in the face. Now we can examine the mouse. If we look for like any kind of disease from there, it can be, for example, pain in the mouse, or pain when the patient swallows, or we might want to examine the larynx, epipharynx, hypopharynx, oropharynx, and look for like abscesses, tonsillitis, edema in the larynx, any kind of laryngite or any kind of pharyngite, and we might even be looking for like tumors we examine the mouse after we have inspected the patient's face and throat, and if we find any kind of, or if we palpate the throat and the face and we find any kind of indication for a tumor, like enlarged lymph nodes, or enlarged glandula, one of the salivary glands, or any kind of any sign of a tumor, then we can look inside the mouse to find probably a primary source for the tumor. It might be tonsil cancer, it might be tongue cancer, it might be cancer in the gingiva, or cancer in the oropharynx, or esophagus. So we start with inspecting the mouse, and we look how the tongue looks, and we can use tongue blade to make it easier to apply some pressure on the tongue, and this way we have a better view of the posterior wall of the oropharynx. And so we look at the teeth and the health of the teeth, and then we inspect the gingiva, and that can be done with the help of 2 tongue blades, so we can have a better look at the gingiva, and we can use small mirrors to inspect the nasopharynx and hypopharynx, and in this way, when we inspect the hypopharynx, we can see the epiglottis and see if there is epiglotite, and we can inspect vocal cords and see if there is any kind of disease there, or abnormality in their movements, and then we can even ask the patient to say this way we can examine the symmetry of the soft plate, and if the uvula is deviated to one side or another, which also can indicate like if the patient doesn't even say ah and it's already deviated, it can indicate tonsil cancer. So that was our lesson for today. Thank you.